This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
Approximately 360 million people are currently affected by some form of hearing loss. It usually becomes a problem when one is perennially exposed to loud noises as one ages. Also called reduced hearing, it is normally differentiated from deafness and is evident through the difficulty in understanding words, especially in a crowded environment. In the Philippines, roughly 8.8% of the population are hearing disabled, with most having difficulties in school or at work because of hearing impairment.
It can be classified as hearing impairment where the performance of the patient is affected because of just a decrease in hearing. One is poor hygiene. If you don't clean your ears properly, you may have accumulation of your earwax inside the ear that can cause hearing impairment. You can get a perforated eardrum when you have colds because it also affects the ear. Even patients who usually dive or ride a plane can cause ear problem.
There are many ways to prevent disabling hearing loss, and it all starts by spotting hazardous noise sources and avoiding them in the process.
There are lots of ways to determine if a patient is hearing impaired. One is just by doing a rough physical examination. We may be able to assess a patient if he has hearing loss just by doing a good physical exam of the ear and tuning for test. Then we can back it up by doing a pure tone audiometry, a speech discrimination test, or a tympanometry.
Can ear infections cause hearing loss? What research is currently being done to prevent and treat hearing loss? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Norberto Martinez, otolaryngologist from the St. Luke's Medical Center. Also joining us tonight is Dr. Alfredo Pontejos. He's also an otolaryngologist from the Manila Doctors Hospital. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Thank you.
Doc
Good evening, Angel.
Norby, Doc Alfie.
Yes.
Okay. Hearing loss. There's a little bit of silence there. Hearing loss. Let's open the discussion by understanding the symptoms of hearing loss. Doc Norby, let's start with you.
Usually, if you have a hearing problem, the tendency is to ask people to repeat what they're saying. No, you keep on saying ha, ha. You tell them to please try to slow down and speak slowly and clearly so I could actually perceive what you're saying. No, most of the time also they have problems in noisy environment also, so they have more difficulties. So one sign actually is when you're starting to have a hearing loss is you hear ringing in your ears. You hear a buzzing sound in your ear. That could be a first sign already that your hearing is starting to deteriorate.
Mm-hmm. So does it come at any particular age, or does it come with aging?
Yes.
Doc Alfie?
Yeah. Among males, it could be as early as 25, and among females, it could be as early as 30 years old. Mm-hmm. And the reason for this is the surrounding that we are in. I mean, because of industrialization, there's a lot of noise all around. And so our hearing tends to deteriorate, and we call this presbycusis. Mm-hmm. So the high pitch sounds that we hear we tend to not hear it as well as we used to hear them before.
Mm-hmm. You've mentioned that, for example, you're in a crowded place or in a noisy place, and you keep saying ha, or can you please repeat what you mentioned. Even if you don't have a hearing problem, it's just noisy. It's just, you know, you can't communicate, you can't understand because there's just noise all around you.
Yeah, more so with a patient who has a hearing problem, no? That's why most of the tests now are doing hearing in noise test because of the difficulty in trying to communicate, no? If you do a test in a sound treated environment, it may not be reflective of the actual communication skills of a patient who has a hearing problem.
Okay, so communication skills, no problem. It's just the sense of hearing that is impaired, so to speak, or that has, you have difficulty in hearing, even a whisper, no? So is that?
Yeah, actually a whisper is a simple screening tool that we're using nowadays. No? In fact, that was advocated by WHO, using the human voice as a way to segregate patients with hearing impairment or those with normal hearing. No? For example, if you try to whisper a meter away, okay, and usually the whisper is at the end of deep inspiration. You try to inspire deeply and then try to whisper. What you whisper actually a combination of numbers and letters.
Okay.
No? Like U is low frequency, U, 3S. Now you have different frequencies, and if the patient is unable to repeat that during your whisper test, that's already a clue that the patient may have some hearing problem.
Okay, so that's one of the tests.
Yeah, in a
determine.
community level, in a community setting, you can actually do that.
And in any community setting or a work environment, there are certain causes that can lead to hearing loss. For a job that might, you might be exposed to 8 hours a day that's really noisy.
Yeah, that's one factor, particularly among adults. And of course, in the younger age group, you have infections like otitis media, which can cause hearing loss. Even as simple as impacted cerumen can cause hearing loss. Okay, so these are some of the factors that can cause hearing problems.
Is there an underlying other medical condition that can lead to hearing loss aside from that of what you've mentioned?
Well, for example, a patient who has diabetes, no? There are more at risk of having hearing problems, but because you know that diabetes is a multi-systemic problem, you can have problems with your blood vessels, you have vasculitis, you have problems with the nerve. So endocrine problems like diabetes can actually lead to hearing loss also. For example, you have hypertension, no? There are plaques around your blood vessels, and they can be thrown out into the small blood vessels in the ear. So you can have problems as well. In fact, it is described that the blood vessel of the inner ear is like end arterial. There are no interconnections, so they're very prone to vascular insult.
So it's just that connection.
It's like a one-way street. No? If there's a block in that blood vessel, then we're in trouble.
Okay, and yes.
Then there are other drugs that might cause hearing loss, what we call the ototoxic drugs. And these are the aminoglycosides. These are antibiotics, particularly the gentamicin. And then you have the diuretics, the etacrinic acid and furosemide. And then you also have salicylic acid, the aspirin. In high doses that can cause hearing loss too. And some other drugs like anti-cancer drugs, like cisplatinum, some other drugs that can cause hearing loss.
And these drugs are taken not because of your hearing loss, but because you have another medical
problem,
condition.
and the side effect could be damaging to the ear, particularly the aminoglycosides. They can be permanent. See, like the streptomycin that we used to give before in TB, it can cause permanent damage in the hearing. Yeah.
So these are side effects of the
side effects
medications that you take, and our sense of hearing is often neglected. You know, when we're inside like a noisy place, we think that it's proper to shout. No, it's proper to communicate by shouting. You leave that noisy place, and there's a little bit of deafness already when you leave a noisy place. So, these are, as you've mentioned, one of the causes of hearing loss. What are the other causes, or what are the other occupational hazards or other jobs that might lead to hearing loss that we're exposed to every single day?
Well, for example, as far as causes of hearing loss are concerned, then you can have congenital causes, no? Say, for example, a mother contracted German measles during the first trimester of pregnancy. No?
Okay.
So the baby can be born with hearing problem, with congenital cataract, as well as congenital heart disease. In fact, that's the reason why we now have universal newborn hearing screening. Now it's a law in the Philippines that all babies born are supposed to undergo hearing screening because
Nice.
they found out that hearing impairment among the babies are much more common than metabolic diseases in the newborn. That's why it's now a law. No? But of course, acquired causes are just as common. No? For example, as Dr. Pontejas mentioned, otitis media, no? You can have that, or a viral illness, like for example, mumps. The virus can actually get into the ear, so you may have problems with that as well. No? And then, of course, noisy environment. We were saying that noise is the most pervasive among the pollutants actually, no? So, and the hearing impairment is something which is invisible. So, it's an invisible disability. We don't pay too much attention to our ears, no? Thinking that it's a slow, it's acquired, so it's not like other problems that it gets to hit you immediately. But this is compounded, slow, and takes a while before you know it, it has damage or hearing already.
And we don't want it to get to that point that it has been damaged or we can't hear as well anymore.
Yes.
You've mentioned paying attention to our ears. Doctors will pay more attention to this topic, hearing loss, all that and more when MedTalk returns.
According to the World Health Organization, around 1/3 of individuals 65 years old and above are currently experiencing hearing loss. Most of those affected come from Asia Pacific, South Asia, and Sub-Saharan Africa.
We're back here on MedTalk, still talking about hearing loss. This time, doctors, we have a caller on the line, Erlinda Reyes. Hi, Erlinda. Good evening.
Good evening po.
Good evening. Yung question niyo po para kay Doc Norby at kay Doc Alfie.
Opo. Good evening po, doctors. Meron po akong question kasi meron akong tinnitus. Hindi ko po alam kung sa ano pinanggalingan nito at paano ito gagaling. Kaya, it's been 5 months now.
Tinnitus. What exactly is tinnitus?
Okay, Linda mentioned that she has tinnitus. No? Tinnitus is otherwise known as ringing of the ears. No? You hear buzzing sound which is coming from inside, which is not coming from an outside source. That's tinnitus. No? Okay. And normally, it is, of course, attached to a hearing problem. So the first thing that we need to do is actually do a hearing test, no? That will guide us as to where the problem is, no? And of course, we need to get some information from the history. We need to examine your ears. For all we know, there's just earwax blocking the ear canal. Once you remove the earwax, then the tinnitus is gone, no? So, good history, physical examination, of course, a hearing test. And then from there, we can have an idea if that is something that we can remedy or not, no? More often than not, the problem is affecting the cochlea or the inner ear. So, the hearing test will give us a pattern of how a cochlear hearing loss would look like, no? And then, of course, we give you advices. No? Is it something that we can remedy by medication or not? No? If not, are there ways to try to make you feel more comfortable despite the ringing of your ears? No? Do we introduce sound from the surroundings which is more pleasant to hear for you so you can have a pleasant sleep? No? And then, of course, we try to counsel patients. That some patients kasi are worried that it might be due to a tumor or something. We need some reassurance for our patients. So it's important to know the cause and then to find out the remedy.
Yes, if it's really secondary to a cochlear problem, it's difficult to treat. That's why, as was mentioned by Norby here, we can have tinnitus maskers. So it's like a hearing aid that you put. So tinnitus is discordant sound. So it's all a mix of noises. So what you put in is a white band, of sound that will sort of counter it, so the patient can sleep better.
Okay.
Can be not disturbed by the tinnitus. But once in a while, we do give some medications and some other drugs, but it's very empirical.
Okay. Erlinda?
Yes, ma'am.
You still have a question for our doctors?
Yes, I've been to what do you call this, ENT, and I underwent this testing of the doctor, and then it seems that everything is okay. My eardrum is okay, my ears is not blocked with any pollutants, whatever. And then I was told to go to the hospital at St. Luke's to undergo this audiometric. And then when I got the result, I went back to the ENT doctor, and then it seems that my hearing has gone down already because yung parang humihina na yung aking pandinig. And then apparently I forgot the name of the prescription that he asked me to buy, because he told me that he has no guarantee whether that will work or not. So I didn't buy the medicine anymore because it's quite expensive.
Is it both ears that the hearing is down, or just one ear?
Well, it seems to be both ears.
Both ears,
because
okay.
Even if I cover my both ears, it seems I can hear it. The hissing sound.
Well, it could actually be, if both ears are affected, it may be related to age. I wonder how old Erlinda is, because we have what you call...
Years old po.
Sorry, kindly repeat. 53?
Yes, ma'am.
Okay, 53 years old.
53.
Yeah, that's quite, if you're only 53, that's quite young for what you call presbycusis, because we say it normally starts at 60, but if you have other problems, medical problems that may have compounded the issue, then that could be present, no? But if you say that your hearing on both sides have deteriorated, it's probably in a sensory neural or cochlear in nature, as we said that once your hearing goes down, the tinnitus goes with it as well, no? So I would think that you were given medications that will enhance circulation to the ear, or probably be given vitamins for the nerve, no? And as a doctor said, it's really no guarantee if the condition will actually improve. But as I said, we are able to provide you counseling and coping mechanisms, no? Because some people actually dwell on it, no? They become overly observant of the situation to the point that it becomes louder than usual because you're focused to the ringing that you experience, no? So as we said, no, being able to explain to you the condition well, being able to describe the hearing result that they did, no, and being able to talk to you, I guess will allow you to be better in terms of your coping mechanism. So you said that it's been on for 5 months already, no?
Yes.
Yeah, it gets to be more bothersome usually at night, isn't it? When it's very quiet. So normally that's where the role of the tinnitus masker would come in. Or if you don't want to buy that, you can just have a radio near your head and put it in mellow music. Okay. So that counters those sounds and you can sleep better. Because in noisy areas, normally you will not appreciate it much. But when it's at night, when it's very quiet, that's when you appreciate it. And sometimes you have sleep disturbance.
Okay.
So that's what you can do about it, yeah.
All right. Okay, thank you very much, Erlinda, for calling.
Yes, thank you very much too.
Thank you.
Thanks.
Bye-bye. Okay, so it is a concern, no, that the ringing in your ears. It bothers the quality of life. You cannot sleep. And sometimes it's a preoccupation because the sounds become magnified already.
Yeah.
You've mentioned a test that can be done. Can one conduct a test without seeing an otolaryngologist first? Are there tests that can be done by the individual?
Well,
check for that?
normally it's always good for a patient to see an ENT doctor, an otolaryngologist, so they can be examined, and of course request for the proper test. No, it's not like you just walk to a place and then you want a hearing test done. Of course, the technicians, the audiologists will not do the test without the request because they want to know exactly what test needs to be done.
So there are different types of tests for different, how would you say that?
Problems.
Problems
Yeah, that's right.
that you experience and that may lead to hearing loss. Now let's talk about the risk factors. Is age a risk factor? Does it come with aging? Hearing loss comes with
As
aging?
you grow older, there's a risk of hearing going down, particularly on high frequency.
So as we age, the natural aging process and the natural hearing loss process, so to speak, do the sounds become different as you age?
Well, normally, as Dr. Alfie mentioned, no, you lose basically the high frequencies first. So like consonants like S, TH, CH, F. So sometimes you can hear, but you cannot understand what the person is saying because you become some sort of tone deaf. Okay. And then you start experiencing tinnitus, no? So, but of course, as you further age pa, then you lose further the hearing to be involving now even the mid frequencies, and it's progressive, no? And of course, if there are other problems that you have, like for example, you have other conditions, like you have other illnesses, and then you're taking plenty of medicines, no? So collectively, that's the end result already.
Okay. Aside from aging, which we cannot stop, what are the other risk factors involved in hearing loss?
Hearing loss, as we've mentioned earlier on, infections. So the more classic would be the otitis media. So it could be acute or it could be chronic, and this is usually secondary to problems in the eustachian tube. Secondary to, for example, you have colds, and then it progresses, it affects the eustachian tubes. The eustachian tube gets clogged, then the area in the middle ear, the space in the middle ear retracts, and then you have fluid developing in that area, and then you develop infection of the ear. So that's rather common, particularly here in the Philippines. What we call luga. Okay, so that's otitis media.
Okay.
And so, of course, some of them will resolve by themselves, but some would progress on to become chronic, and others could have complications. And so, if you have this, you have to go to a doctor and have it treated, because we had a survey before, and the regular parent would say that's part of growing up. They're having ear discharge, and they will do well later on, but that's not true. Some of them would resolve, some would progress to chronicity, and the others would have complications. So the moment the ear is discharging, definitely they have hearing loss, they have to have a consult with a doctor.
Right away. No. You mentioned growing up. I just wanted to talk about growing up. The kids these days, they have all their gadgets to to enjoy their music all the more. In their teens, in their early 20s, they watch on their iPads. They have the earphones.
Yes.
Will it lead to hearing loss if they keep doing it often, or they listen to loud music?
Exactly. We were saying that noise pollution is very rampant, especially nowadays that we are in the age of technology.
Yes.
You use your MP3 players, your iPads, your earbuds, no? So now it's important for you to know if it's loud enough to cause hearing problem, no?
Okay.
If you're using a gadget, for example, you're listening to your gadget and somebody tries to talk to you and you cannot understand that person, that's loud enough, no?
All right.
If you have your earbuds on and then the person next to you could actually hear what you're listening to as well, that's loud,
loud, yeah.
no? Well, gadgets now are, of course, sophisticated, that they have the noise cancellation effect,
yes.
no? So, of course, it depends on the type of gadgets that you use, no? If they're more or less high-end, there's good quality control, fine. But, you know, if you just buy a gadget that you get from, you know, from nowhere, where we are not assured of its quality, those features might not be present.
Okay.
Yeah, you measure loudness by decibels. So what is allowable is between 80 to 85 decibels for 8 hours. Beyond that, it can cause damage to the ear. So it's important that your gadget should be tested. I think there was a law somewhere in another country that limited it to 80. So I don't know if, that's why you have to check your own gadgets for that. If they go beyond that, then this child could be in trouble. I've seen some patients very young, 20, 25, and they already have hearing loss. And history is they have been using their earphones and earpods for a long time. So.
Wow, they don't realize the
Yeah.
importance of hearing well, no, and being
That's right.
able to understand and being able to communicate well when they just keep on using all these gadgets, and then one day it's gone. You know, your hearing is gone. You can't hear anything anymore. You won't be able to appreciate the sounds that you're supposed to appreciate on a certain level. You mentioned gadgets. I understand there's an app that,
yeah.
Doctor, we'll talk
That's
about
right.
that app
Okay.
when MedTalk returns. We're back here on MedTalk, still talking about hearing loss. You may join in the discussion by calling our hotline at 548-4678. Doctors, before we got to the break, we were talking about the kids' gadgets, the usage of these gadgets, which can lead to hearing loss. And you've mentioned an app that we can download on our phone to check for sound loudness.
Yes,
Is that correct?
Yes. So there's an app here which you can download for free, and so it's like this. So you could be able to see what is the sound level in this area, in this, where we are right now. So you can see it ranges from 70 something. So that's still acceptable. But if it goes beyond the orange, then it's a little bit dangerous, particularly it goes to 90. So we're on the average 70, 80. Yeah, that's still acceptable. So this is one way for you to test if in your area the sound is a little bit excessive. So you can avoid an area. So it can lessen your risk of having problems with your ear.
Okay.
This is for free, so you can just download
What
it.
exactly is the talk? Or we can flash it.
It's a decibel. Yeah, it is a decibel something.
Okay.
Which you can just download.
All right.
On your app, on your cell phone.
Okay. We can just decibel. Okay. It's a decibel app, and maybe when you go out, and you feel that it's too noisy around you, you can take out your phone and check for the loudness. Yes. Okay, that's a good app to have. You know, you've several other apps on your phone.
That's
Why not have one that can test the loudness of the particular area you're in?
Yeah.
This time, doctors, let's talk about the types of hearing loss. I understand there are two. Let's start with the first one, Dr. Norby.
Well, you can have what you call conductive hearing loss. So the problem is in the outer or in the middle ear. Before reaching the inner ear or the cochlea, that's conductive hearing loss. Like for example, you have an earwax blocking the ear canal, or the eardrum is busted, perforated, as in otitis media, or the small bones in the ear, the ossicles, the hammer, the anvil, the stirrups are not connected to each other. Then those are what you call conductive causes of hearing loss.
Okay, what causes these?
As I said, improper hygiene, that you push the earwax, or you have otitis media because of a bad cold.
Okay, so pushing the earwax. Let's go to cleaning our ears. Should we clean our ears after we bathe?
Yeah,
Each and
actually,
every time?
the ear is self-cleansing, so the ear itself pushes out the wax. So what you should do is just clean the outer portion of your ear. Don't, if you use a cotton bud, then you just just one half of that cotton tip, one half of that cotton itself should be in the ear, because the moment you go inside, there's a risk of you pushing the wax inside.
Okay, and that can block.
Yes, and that can block gradually. You know, you're pushing and pushing every day, and then after a while it gets blocked. Yeah.
Okay, so once a week, once a month?
Ideally, yes, once a week would be fine. Yeah.
Okay, it's become a habit for everyone to
Yeah,
clean
that's
their
right,
ears shortly after you take a bath.
That's
or,
right.
You know, every time you see a cotton bud,
Yeah.
you clean your ears, but apparently it's not helpful,
Yes.
and it's not good. How about those who swim, who are divers? Can they get conductive hearing loss? Are they prone to that?
Yeah, because of, you know, when you dive and the descent is so fast, okay, you can bust your eardrum actually, you know. We have what you call barotrauma. That's a condition wherein the negative pressure builds up in your ear, okay, and there will be seepage of fluid from the small blood vessels that can build up in your middle ear. That also happens, for example, when you fly, you know,
Yes.
the sudden ascent and descent, and you're not able to equalize the pressure well, then you can have initially your eardrum being retracted and then seepage of fluid. So then the whole middle ear is filled with fluid, then you can have that condition.
So when you fly, you have to
You should
Open
learn
your
how to
Equalize.
equalize, no?
Open
And
your
of
mouth.
course, when you have a cold, when you fly, make sure that is addressed actually.
When you have a cold and you keep blowing your nose, sometimes you get deaf in one ear.
Yeah, because you cannot equalize. See, the pressure pushes air into the middle ear, and then, you know, it doesn't come out. So that's a problem. And after a while, that fluid, or rather that air will get absorbed, and then there's transudation of fluid. And that's when you have problems.
Conductive hearing loss is temporary or is it permanent? And
Yeah.
how do we address this condition?
Usually, they're the ones that can be addressed medically or even surgically, no? So they're what you call reversible problems that we can address, no?
There's another type of hearing loss, I understand,
Yes,
doctors.
and that's
Let's talk about
sensory
this.
neural. And when you say sensory neural, that's from the promontory. So you have the small bones, and then you have the oval window, and you have a round window, and then you have an area in between which you call the promontory, going back to the cochlea, and that will be the area of the inner ear. So when your problem is in there, that's what you call sensory neural. And there's a simple test that you could do, you know. When you tap your head this way, that is actually sound going directly into the cochlea. So that's actually the base of pure tonal geometry. So you test for the conductive, which is from here, and then the bone conduction, which just by tapping you're able to hear, so you can see the difference. In sensory neural, both of these are down. Both those the bone and the air conduction, both of them are down. See, so what are the examples here? Like, yeah, the rubella syndrome, okay, and then some of the congenital anomalies. And in the adults, you have what you call fluid problems like Meniere's disease, you know, and then the toxins, the autotoxic drugs, they cause sensory neural hearing loss.
Is this reversible? Can you treat this with medications or maybe even surgery?
Well, depends on the cause, no? There are conditions that you can treat medically, no? But there are conditions that you can't. That's why you have to do something about it, no? Well, for example, no, like if you end up with an irreversible hearing loss that cannot be addressed by hearing aids, then we can actually do surgery to address this problem. That's what you call a cochlear implant surgery.
So there's surgery and there's a hearing aid. Who
Yeah.
are candidates to use a hearing aid, and who are the candidates that might require surgery?
Well, basically, if you have a hearing problem that cannot be addressed medically, or there are contraindications, no, or that cannot be addressed surgically, then you go for a hearing aid, no. A hearing aid is something you use when your hearing loss is at a level wherein it will affect your communication, no, your function, then you go wear a hearing aid. No? Now, if it comes to a point that the hearing aid cannot help you at all anymore, no, then you go for a cochlear implant.
This doesn't choose any age, the implant or the hearing aid?
Not really, no. In the Philippines, the youngest that had been operated on is less than a year old, and the oldest that have been operated on is about 70 years old. So in industrialized countries, they even operate on patients who's 80 and above.
Wow.
For as long as, you know, they're quite healthy, they can undergo the surgery, fine, they go for the surgery.
And the quality of hearing that they will have after the surgery, what is that like?
For cochlear implant, you have to have training, right? Well, for the adults, then it's easier to train them, but for the young ones, you have to. There's what you call a series of training, you know, for them to learn how to hear.
How to hear, and this implant is just done once for the younger ones.
Yes.
It's not repeated when they're older.
The surgically implanted component is there for life. No, if there's an upgrade, it's the outer components, like, you know, like any gadget, there's upgrade. You know, so they're the ones that have been upgraded.
Okay, doctors. When we come back, we'll talk about hearing loss. I understand there are different levels of hearing loss. All that and more when MedTalk returns.
Did you know that listening to music through earphones and headsets may lead to hearing loss? According to the World Health Organization, the louder the music and noise, the bigger the risk of hearing loss, especially for young people.
We're back here on MedTalk, still talking about hearing loss. This time, doctors, we have a question from Facebook. Can you get your normal hearing back if you already have developed hearing loss? Can you get your normal hearing back if you've already developed hearing loss? I had to repeat that.
It really depends on what the cause of the hearing loss is. Okay, as we have mentioned earlier on, if it's conductive, like you have an infection, you have a perforated eardrum, it can be repaired. If, or some of them at an early stage can just close by itself. See, so it depends on the type of problem that you have. There are some sensory neural hearing loss that are reversible, okay, and some are permanent. So it really depends on the type of hearing loss that you have. Yeah.
Okay. And depending on the type of hearing loss, it leads us to the degrees of hearing loss. What are the different degrees of hearing loss?
Well, our hearing is actually measured in terms of decibels, so the loudness that you can actually perceive, no? So we say that you have a normal hearing level if your hearing threshold is anywhere between 0 to 25 decibels. As we said, a simple screening test is finger friction test or a whisper test, a meter away, is more or less about 30 decibels. So that's a good guide in a sound untreated environment, no? Okay. So now we know if you're hearing, if you have hearing problem or not, no? So if your hearing threshold is anywhere between 26 to 40, then you may have a mild degree of hearing loss, no? So a simple tool that you can use is, for example, your watch. Put your watch an inch away. If you cannot hear that, more or less that's about 40 decibels, no? Now, if your hearing threshold is anywhere between 41 to 60, then you have what you call moderate degree of hearing loss, no?
Okay.
Our human voice is more or less 60 decibels, no? So if you stand away an inch, a meter away, that's how we measure a meter more or less, and then we try to, you know, to speak in our normal conversational voice, and you cannot hear that, then maybe your loss is even worse than a moderate degree of hearing loss, no? Now, if your hearing threshold is anywhere between 61 to 80, then you have a severe degree of hearing loss, no? Loud voice is more or less 80 decibels. So if you cannot hear that, then your hearing is worse than a severe degree of hearing loss, no? Then that goes to a profound level. Now, that's 81 and higher, that's a profound degree of hearing loss. No? Shouted voice is 100 decibels. No? So if you cannot hear that, then definitely that's a level wherein you have a profound degree of hearing loss. Basically, you're deaf. So no matter how loud it is, you cannot really understand.
So that level, you really must seek help already.
Well, we have what you call disabling hearing loss already, you know. In fact, WHO has a criteria. If you have a disabling hearing loss now, it's a law in the Philippines also, that you can have access to a PW card, persons with disability card, and you get 20% discount. You don't have to wait till you're a senior citizen to get a 20%. So by law now, if you come and have your hearing tested, if you were a child and the hearing threshold in the better is worse than 30 decibels, then you can have access already to a disability card. If you were an adult, if the hearing threshold is worse than 40 decibels in the better ear, then again, you can get a disability card. No? So the cutoff age is 15. So if you're below 15, then you follow that rule, 30 decibels in the better ear. Above 15, the rule is if your hearing threshold is worse than 40 decibels in the better ear.
Okay, so maybe a lot of people will start doing the test now.
Have your test done. For all you know, you can have a disability card.
Because off cam we were saying that hearing loss is an invisible disability. I mean, we see those who have a disability and we identify it right away, but with hearing loss, you won't know until you speak to that person or until that person goes, huh?
Exactly, and there's always denial, right?
Yes.
You know, you keep on denying that you have a problem.
And it affects not only you, but the people around you.
Around you.
Of course, they don't want to offend you by saying that, you know, you might have a hearing problem, you can't understand what I'm saying. But how do you say that politely? How do you tell them that, you know, you might have a hearing disability, that you might need to see a doctor?
Well, we basically would tell them outright that we believe that you may have a problem and it's worthwhile having a hearing test, and because we may be able to prevent progression of this problem, or once we discover the cause, we may be able to reverse your problem. So I think for people who are concerned or who are health conscious, they wouldn't have second thoughts of having their hearing tested.
Maybe you could say, why don't both of us have a hearing test?
Oh, that's better. That's a good idea. That's better. That's better.
So they don't offend a more sensitive person.
Well, that's a good
Particularly
idea.
if he or she, he or she is your mother, or someone very close to you.
And little do you know, both of you need a card.
That's right. As the saying goes, misery loves company.
That's right. But you know what? We've been talking about learning more about hearing loss. Misery loves company. But you must encourage someone to get that hearing test with you. It's Deaf Awareness Week, the week of November 9 to 16. Please tell us about the activities that are going to happen.
Yeah, we're celebrating Deaf Awareness Week. That's November 9 to the 16th. So this program is very timely, no? So now we get to be aware of our conditions and we take care of our ears, no? President Ramos said, no one is more deaf than the one who refuses to listen. So we really have to pay attention to our hearing, no? There's so many activities. We're looking at, training barangay health workers. We're doing a quiz contest also to make people aware of the problems, no? And we have a seminar also regarding employment for the deaf, that they are integrated in the community. So there's so many activities. We have opening ceremonies, and then we have games also for the hearing impaired. No?
Oh, nice. We can be part of that activity. We start talking about hearing loss here on MedTalk. Doctors, any final message? I'm sorry we've run out of time. But, we'd like to hear what you have to say.
I think what's important is prevention. For the women that could be pregnant later on, I think they have to have vaccines. And the more important vaccines would be German measles vaccine. And for the child, it's important to have a H-flu vaccine, and also a pneumonia vaccine. I think this will lessen the risk of otitis media. Then, of course, the awareness, education about caring for the ear is important, and also awareness of the noise around us. That's why you could have an app to test whether the area is too loud already, to the detriment of your hearing.
Okay.
So I think these are some of the basic things that you could do. Of course, a healthy lifestyle, of course, always there, and so that could lessen the risk of having hearing loss.
Thank you,
Yeah.
Doc Alfie. Doc Norby.
Well, we should also remember that hearing is a right, it is not a privilege. So we should take care, of our condition, and government is doing things also to try to help us cope up with the situation.
Thank you very much, doctors, for helping us understand more about hearing loss. We hear you loud and clear, and we know that we have to take good care of our ears as well as the other parts of our body. Not to forget this part of our body that helps us enjoy music, that helps us engage in good conversation, and that helps us learn more by watching our show. So thank you once again, doctors.
Thank you very much too, Angel.
Thank you. We'll see you again next Tuesday. Oh, we'd like to thank our caller and those who sent in their message via Facebook. We'll see you again next Tuesday, 7 p.m. here on MedTalk, your scheduled on-air consultation on 9TV. This is Angel Jacob. Good night. This program aims to find solutions to your medical queries. It seeks answers to common health problems that have been hounding you. We will help you out in finding answers to your medical concerns. Good evening, everyone. I'm Angel Jacob, and this is MedTalk, your weekly on-air health consultation here on 9TV.
Approximately 360 million people are currently affected by some form of hearing loss. It usually becomes a problem when one is perennially exposed to loud noises as one ages. Also called reduced hearing, it is normally differentiated from deafness and is evident through the difficulty in understanding words, especially in a crowded environment. In the Philippines, roughly 8.8% of the population are hearing disabled.
And if the patient is unable to repeat that during your whisper test, that's already a clue that the patient may have some hearing problem.
Okay, so that's one of the tests.
Yeah, in a community level, in a community setting, you can actually do that.
And in any community setting or a work environment, there are certain causes that can lead to hearing loss. A job that might you might be exposed to 8 hours a day that's really noisy.
Yeah, that's one factor, particularly among adults. And of course, in the younger age group, you have infections like otitis media, which can cause hearing loss. Even as simple as impacted cerumen can cause hearing loss. Okay, so these are some of the factors that can cause hearing problems.
Is there an underlying other medical condition that can lead to hearing loss aside from that of what you've mentioned?
Well, for example, a patient who has diabetes, there are more at risk of having hearing problems, but because you know that diabetes is a multi-systemic problem, you can have problems with your blood vessels, you have vasculitis, you have problems with the nerve. So endocrine problems like diabetes can actually lead to hearing loss also. For example, you have hypertension, there are plaques around your blood vessels, and they can be thrown out into the small blood vessels in the ear. So you can have problems as well. In fact, it is described
with most having difficulties in school or at work because of hearing impairment.
It can be classified as hearing impairment where the performance of the patient is affected because of just a decrease in hearing. One is poor hygiene. If you don't clean your ears properly, you may have accumulation of your earwax inside the ear that can cause hearing impairment. You can get a perforated eardrum when you have colds because it also affects the ear. Even patients who usually dive or ride a plane can cause ear problem.
There are many ways to prevent disabling hearing loss, and it all starts by spotting hazardous noise sources and avoiding them in the process.
There are lots of ways to determine if a patient is hearing impaired. One is just by doing a rough physical examination. We may be able to assess a patient if he has hearing loss just by doing a good physical exam of the ear and tuning fork test. Then we can back it up by doing a pure tone audiometry, a speech discrimination test, or a tympanometry.
Can ear infections cause hearing loss? What research is currently being done to prevent and treat hearing loss? Find out the answers tonight on MedTalk.
And joining us tonight is Dr. Norberto Martinez, otolaryngologist from the St. Luke's Medical Center. Also joining us tonight is Dr. Alfredo Pontejos. He's also an otolaryngologist from the Manila Doctors Hospital. You may join the discussion by calling our hotline at 548-4678. Good evening, doctors. Welcome to the show.
Good evening.
Thank you.
Doc
Good evening, Angel.
Norby, Doc Alfie.
Yes.
Okay. Hearing loss. There's a little bit of silence there. Hearing loss. Let's open the discussion by understanding the symptoms of hearing loss. Doc Norby, let's start with you.
Usually, if you have a hearing problem, the tendency is to ask people to repeat what they're saying. No, you keep on saying ha, ha, and you tell them to please try to slow down and speak slowly and clearly so I could actually perceive what you're saying. No, most of the time also they have problems in noisy environment also, so they have more difficulty. So one sign actually is when you're starting to have a hearing loss is you hear ringing in your ears. You hear a buzzing sound in your ear, that could be a first sign already that your hearing is starting to deteriorate.
Mm-hmm. So does it come at any particular age or does it come with aging?
Yes.
Doc Alfie?
Yeah. Among males, it could be as early as 25, and among females, it could be as early as 30 years old. Mm-hmm. And the reason for this is the surrounding that we are in. I mean, because of industrialization, there's a lot of noise all around. And so our hearing tends to deteriorate, and we call this presbycusis. Mm-hmm. So the high pitch sounds that we hear we tend to not hear it as well as we used to hear them before.
Mm-hmm. You've mentioned that, for example, you're in a crowded place or in a noisy place, and you keep saying ha, or can you please repeat what you mentioned? Even if you don't have a hearing problem, it's just noisy. It's just, you can't communicate, you can't understand because there's just noise all around you.
Yeah, more so with a patient who has a hearing problem, no? Mm-hmm. That's why most of the tests now are doing hearing in noise test because of the difficulty in trying to communicate, no? Mm-hmm. If you do a test in a sound treated environment, it may not be reflective of the actual communication skills of a patient who has a hearing problem.
Okay, so communication skills, no problem. It's just the sense of hearing that is impaired, so to speak, or that has, you have difficulty in hearing, even a whisper, no? So is that?
Yeah, actually a whisper is a simple screening tool that we're using nowadays. No? In fact, that was advocated by WHO, using the human voice as a way to segregate patients with hearing impairment or those with normal hearing. No? For example, if you try to whisper a meter away, okay, and usually the whisper is at the end of deep inspiration. You try to inspire deeply and then try to whisper. What you whisper actually a combination of numbers and letters. Okay. No? Like U is low frequency, U, 3S. Now you have different frequencies.